Thanks, Bruce. And I know y'all are probably really eagerly waiting Rule 40, so we'll try not to go over. I see Steve sitting here with a very large yellow folder. Yikes. It's a little different than my yellow folder, but as Bruce mentioned, and as Representative Abler mentioned this morning, families, I don't think I could say it any better than Representative Abler did. They have just such important messages that we really want to start talking about at the legislature. And those stories are what make the legislators remember us when they're voting on the House floor. So today we have gathered two fabulous panelists, Elizabeth Armstrong from Hammer Services and Mary Thurston from Phoenix Residents, that are going to be talking a little bit about the programs that they've been able to implement within their agencies to get families involved at a grassroots level. So not to drag it on, but so I think we'll start with Elizabeth, and if you can just tell us a little bit about your program, what you guys do over at Hammer.
Okay. Can you hear me? I don't know how far I need to get from the mic. The program that I'm going to tell you about was really, the idea for it was really born up here. In 2009, I think it was, we had an activity around grassroots advocacy where we had to kind of determine where each of our agencies were on a continuum of looking at advocacy. And one of the things we saw in what we do is that there was really a hole in the fact that we didn't have, we were disappointed in the number of families that we had involved. So after we got back from leadership, we formed a board committee, a public advocacy board committee that is made up of board members, family members, and staff members. And so from that group, we developed a program called the House Captain program, where we have a person at each one of our sites who we've designated as the House Captain. We've designated and they've agreed to be the House Captain for that group. So what they essentially do then is, after they've been designated, we did some training with them and kind of talked to them about what their job description was, gave them information about just general advocacy, what that entails, and we just helped them through what we thought our process was going to be. So the way it's communicated, so after we did the training, then we designated one staff member who is the person who sends out emails to each of the House Captains, and then that person, the House Captain, then emails or communicates with the other people in the area or the site that they are designated for. So whenever there's an ARM alert or an ARC alert, I'm sorry, I know I shouldn't say ARC up here. I guess that's okay, we're friends, aren't we? So they along with ARM have been very helpful to us. Whenever there's an alert that goes out that really is appropriate for families, we send that on to our House Captains, who then pass it on to the rest of the families. Another thing that we did, speaking of ARC, is they have a template for writing your story. And it's really been helpful, because what we realize is that legislators look at you and I when we go and do advocacy, and on some level we're paid. So so our voice isn't as important. It isn't as important, but it isn't as powerful as a family member's voice. And so I think that was really helpful. So we helped people to write their story, and we have on our website a family area where we have copies of people's stories so that others can use it as a template. And it's just been really, really fun.
Thanks, Elizabeth. And I also mentioned, I'm sure ARC has a really good template. Back on that grassroots table, on the back side of on the back side of the one-page document that says what is grassroots advocacy, we also have a nice story writing template.
I bet there's someone.
Mary, if you want to talk a little bit about what the Phoenix does, that'd be great.
You know, our story is very similar to Hammer's. We started our family council in 2007. We just identified people from different homes who we thought would be good to come to our council and provide some feedback on our systems and our processes. So we started with some education. You know, we had families saying, what's your hiring process and what kind of training are your employees getting? So we did education on what our hiring process is, and you know, how are our menus developed, and what kind of orientation do our new employees go through? What are our health services like? What services can we do and can we not do? So we started with an education piece for our family council, and then we went into things like we wanted feedback from them. So we asked our family members to do meal surveys at our different locations. The participation kind of waned over a couple of years, and then in maybe 2010, we started to really focus our family council more on legislative advocacy and trying to engage our families more. And we did the same thing. We identified, asked a family member if they would be willing to chair the family council. She said yes. We identified family council liaisons who reach out to every single other person within the home. It's a little harder, I think, for some of those family members to say no to another family member than it is for them to say no to us. And that has been pretty effective. And I guess our participation, or their participation, has stayed pretty constant and actually increased over the course of, well, since we've been doing this process for about 2 years now.
And I know the Phoenix residents actually had family members come to our day at the Capitol last year as well, which was awesome.
Yeah, in 2010, we had 2 family members participate, and last year we had 14 family members participate. So, you know, in the grand scheme of things, with how many people we served, maybe that's not that many, but that was a huge increase for us. And we had ARC come out and do some training. We had Sarah and Barb come out and do some training. We got our managers well trained so that they could help family members. We invited family members to those training sessions. So the education was key.
Mary, I'm going to start with you, but can you talk about any roadblocks that you ran into?
I think one of the big roadblocks was family members saying, I'm intimidated by the whole legislative process. You guys throw out the term waiver. What does that mean? You throw out language and terminology that I don't think I could adequately speak to a legislator. And so we tried to break it down. We did that education, and we said, you know what? All that other terminology doesn't matter. They want to hear your story. We have one woman, she has 3 sisters living in one of our homes. And when her mom and dad died, you know, she said, I got to carry this torch for my mom and dad. We have another gentleman whose brother lives in one of our homes, and he said, I'm quite sure that my brother wouldn't be alive today if he didn't move out of the nursing home and come into this Phoenix home. And we said, Terry, what a story have you got to tell? You've got to share this. And I remember Beth Scalzi was out at one of our homes, and she was kind of mesmerized by this story as he was telling it. So it was helping them realize you do have a powerful story to tell. And our stories, like you said, Elizabeth, seem a little self-serving.
Elizabeth, can you talk about some roadblocks?
Well, I would say we have very similar roadblocks. It's terribly intimidating. How many in this room are intimidated by the process, and imagine not being a professional and not having all the training and the education that we all have, and then having to go to talk to someone who's an elected official. Pretty scary. So I think one of the things that we've struggled with and worked hard on is distilling the story down into something that that families feel comfortable disseminating and legislators get in a really short period of time. So.
And I think one more thing is, one of the roadblocks to getting families to even the day at the Capitol was the whole logistics. I mean, we mapped it out. You can meet here, we will provide transportation, or, you know, we gave maps, we did an orientation for them, we had our managers meeting with the family members when they were scheduled to meet with a legislator. Sarah's great schedule that she sets up. We had identified Phoenix employees who were going to, you know, pair with a family member, so they didn't have to. We tried to pull the fear out of it for the families, and mapped everything out so they knew exactly what was going to happen at what times throughout the whole day, down to, we'll give you a ride if you need to get a ride, because it's hard to park down at the Capitol.
So one thing that we've been hearing over the past couple of years from members as they've struggled to get families involved is that perhaps they tried to protect them too much from the realities of what we're facing at the legislature, and so they're really not thinking that it's important to get involved. Are there any messages that really resonated with your group to make them feel like they want to become more involved?
You know, I think the message that really worked for our group was that success matters. That when the reason we have not had the devastating years that we have been talking about for the last number of years is because of the voice of so many people. And I think that motivated families to get involved and to be a part of it. And as you see them having some success, then their voice telling other families that this really works, it's infectious. It's been exciting.
Mary?
I think one of the things that our family members want is consistent, well-trained staff, as any family member does. But they felt that maybe I can have a bit of an impact on the ability to keep my staff, to keep the good staff that Phoenix has, to care for my family member if I go down and tell my story. So I think having them realize that in some small way I might be able to explain to the legislators why my family member needs the people there that are caring for them, and so we got to pay them a livable wage. We got to get them some benefits. Don't make these cuts. My family member needs these people. So I think that was that, you know, they're concerned about the turnover, and I think that resonated with them. That if I can have some impact on that, I want to do this.
Sarah, if I can add another thing, I think too that families, one of the messages that we gave to families was the way services that are being delivered right now, the way they got to where they are today was very much because of the voice of families. And so that, but then we all came in and kind of did a lot for families and for the men and women that we support, and kind of gave the message that everything's okay now, you don't need to get involved. And so we really encouraged families and talked with them about, we need you back again. Your voice is so important. So
Great. So to wrap up, if you guys could give the most important thing you've learned through going through this process of creating your family council, what would you tell your peers? Elizabeth, I'll start with you.
I guess just find ways to make it as simple for families as you possibly can so that you don't intimidate them. And like Mary was talking about, you have to pair people up so that they're not going before a legislator on their own, because that's just too scary and they won't do it. So just providing that education and support has really been vital.
And I would say the same thing, and reminding the families that they really do have a powerful story to tell. We've had days where, come on down, write your story, we'll help you frame it. You give us the details, we'll write it for you, but you just supply the information. But just reminding them, you have the most powerful story to tell, and it will really have an impact.
Thank you. So I think to wrap it up, it goes a lot, it's very similar to our advocacy partner program, where it's the peer-to-peer communication that really makes a difference. And you're telling families to asking them to talk to their other family members so they can see, well, if they have time to do it and they think it's important, maybe I can do it as well. I want to point out we do have the grassroots table in the back of the room with lots of resources, best practices of getting involved with grassroots advocacy, letter writing toolkits, site visit toolkits, and I'm always here as a resource. And then we're constantly working on creating new tools, and that's going to be a big focus for us this fall going into the winter, on more tools to help you get your families more involved with grassroots advocacy. Because like I said, they really have important stories that we need to get heard by the legislators. So, Bruce, do you want to wrap up?
Oh, we have a question.
Just quickly, has anybody used a volunteer to maybe help
their agency because of their size to be able to handle some of these activities of engagement?
You know,
We definitely have used volunteers, absolutely. Some people, you know, when you find someone who's really engaged in the political process, and that's the perfect person to get in you know, to have kind of head the whole thing up. And didn't you talk about that?
Well, it was just one of our family members.
Uh-huh.
We haven't used volunteers, but we're trying to start kind of a share your talent program, and that would, so that it's not so intimidating of volunteering, it's just come and share your talent, and that would be a perfect example of somebody who was politically involved or had an interest in that to use that.
do we have any other questions? Yes. Craig is more bossy with the mic than.
Thank you, Craig. How important do you think it is that families understand that the supports come as a result of Medicaid investments in the state? I was very surprised in talking with families that they had no idea that the whole conversations going on around Medicaid had any translation to what was going on with their loved ones.
Oh, Bruce, you want to?
Sure. Yeah, I think it's really important, and in fact, I'm quite stunned how in the discussion in the election this year, how so little has been, attention has been paid to Medicaid, and it's more Medicare, when it's grandpa and grandma, mom and dad, Sam with a disability here, Julie with one over there, that's Medicaid. I think, you know, if I was getting some themes out of what folks were saying, it was family to family, you know, communication. It was just telling your own story, but you're right, Julie, that there needs to be a little bit of context. And the third main point I was getting out of the group was make it simple. And this is what Medicaid, you know, Medicaid is, you know, we're not going to be able to sustain the services because Medicaid is going broke. You know, I mean, it can be something pretty simple. And they've heard about that and that the impact that's going to have. You know, one thing I was thinking about when you folks were talking about what's the main motivator, I think knowledge of, you know, it's going to change, and I'll be able to express that simply, and then provide the avenues simply, and then they can, you know, just tell your story. I don't know if you saw, even, you know, Representative Abler's heard a lot of stories, and so have a lot of other representatives. But when he was talking about people today, he was tearing up, and it's okay for you or your families to cry, and it's okay because often legislators were people too. If they're moved by a story, wow, that's important. So anyway, I went on.
I just want to add, one of the things that we said to our families, and this gets to the message of making it simpler, is when we were talking about bills that would have cut our services, we have said to families, what that means to you is for your daughter or your son, if we get a 3% cut, that means his or her per diem gets cut by that amount. And that makes it a bit more personal for them. And that was really powerful. So that might be a helpful message to use as well.
Yeah.
Does anyone
As
else?
personal as possible.
Mm-hmm.
Yeah.
Mm-hmm.
Great, thank you guys. I will say, one thing we do, Barbara and I used to go around and do advocacy trainings, and the last hour of it was we had people actually practice telling their stories. So that could be something that you might want to do at a staff meeting or any other kind of meeting, is actually getting up and practice saying it out loud. Because you can think it in your head, but actually saying it out loud makes a big difference when you're talking to your legislator. So if there's nothing else,
Good job. Thank you.
all right, thank you.